You know, when something just feels, well, off. Maybe your dog coughs a little after running around, or you just get that kind of nagging feeling something's not quite right inside.
Yeah, it makes you think about all the complicated machinery ticking away in there.
Totally. And today, we're diving into a condition where some of those internal bits can actually end up where they shouldn't.
Mm.
We're talking about diaphragmatic hernia.
It's pretty fascinating, really. You've got the diaphragm, this big sheet of muscle separating the chest from the abdomen, and somehow there's a flaw.
A flaw, yeah, an opening.
Right, an opening. And when an organ that's supposed to be in the belly kind of sneaks through that opening into the chest, well, that causes problems.
Exactly. Like intestines, or maybe even the stomach, taking an unscheduled trip north through a hole in that diaphragm muscle.
Yeah.
They end up in the chest cavity, which is definitely not where they belong.
Mm-hmm.
So we've gathered a bunch of info on this, the basics, what causes it, the signs, how vets figure it out, and what can be done.
And our mission, really, is to pull out the key pieces for you.
Yeah, so you can grasp the essentials of this condition, how it happens, what you might see, and how the experts tackle it. We'll look at both the kind caused by injuries and the type some animals are just born with.
And if you think about what the diaphragm does, I mean, his main job is breathing, right? It's huge.
Crucial.
So any damage, any breach that lets abdominal stuff into the chest is going to directly mess with how the lungs work.
Right. Okay, so let's nail down the basics. In simple terms, what is a diaphragmatic hernia?
Okay, simply put, it's when an organ that normally lives down in the abdomen, the belly area, pushes up through an abnormal opening in the diaphragm.
That muscle right under the lungs that helps with breathing.
Exactly. And our sources point to basically two main categories for how this happens.
Yeah.
It's either acquired, usually meaning from some kind of injury, or it's congenital.
Congenital meaning they're born with it.
Correct. Born with that opening already there.
Okay, let's take acquired first. How does
Yeah.
that usually happen? Like, paint us a picture.
So the most common way an animal gets one is through some pretty significant trauma. Think being hit by a car or maybe a really forceful blow to the belly.
Ouch.
Yeah. Imagine a sudden, intense squeeze on the abdomen. This creates this huge pressure difference between the belly and the chest.
Oh, okay.
And that force can literally tear the diaphragm. The info we have suggests the tear usually happens in the muscular part of it. It's like too much pressure and pop.
Like popping a balloon. Yeah,
Yeah.
that makes sense. A sudden force of physical rip. Now, congenital, that sounds like it develops earlier, like before birth.
Exactly right. Congenital diaphragmatic hernias, you might hear them called pleuroperitoneal or peritoneo-pericardial diaphragmatic hernias. PPDH is the short version.
PPDH, got it.
Yeah, they're born with these. And what's really interesting here is that sometimes these congenital hernias show up alongside other birth defects.
Oh, like what?
Well, the list includes things like umbilical hernias, where the belly button area doesn't close right, or actual defects in the abdominal wall itself, undescended testicles, cleft palate, even heart problems.
Heart problems, too.
Yeah, like a hole between the heart chambers, a ventricular septal defect, or a narrowing near a major valve called aortic stenosis, and even something called portosystemic shunting, which affects blood flow to the liver. It's quite a range.
Wow, okay. That really shows how development is all linked up. So whether it's from an injury or they're born with it, what's the immediate big problem this causes?
The biggest, most direct impact, like we touched on, is on the lungs. Simple physics, really. When organs from the belly move into the chest, they physically take up space.
They crowd things out.
Exactly. They squash the lungs, basically, preventing them from expanding fully when the animal tries to breathe. The sources specifically mention the lung not making good contact with the inside lining of the chest wall, the parietal pleura.
Ah, the parietal pleura.
And that lack of contact is a key reason the lungs can't inflate properly. It's like trying to blow up that balloon inside a box that's already full of other stuff.
Good analogy.
Yeah.
So less space for the lungs. And if it is caused by trauma, I guess there can be direct damage to the lungs too.
Oh, absolutely. With acquired hernias, the trauma itself often causes direct lung injury. This could be lung contusion, basically bruising the lung tissue, or atelectasis.
Atelectasis.
That's when the tiny air sacs in the lungs collapse. They just can't fill with air. Plus, trauma can damage the small blood vessels in the lungs, making them leaky.
Leading to fluid buildup.
Precisely. Fluid builds up, causing edema. All of this makes it much harder for the animal to get oxygen in and carbon dioxide out. That's what we mean by poor gas exchange.
And it's not just the lungs directly involved in the hernia, right? You mentioned trauma can affect other nearby things. Ribs, the heart.
You got it. Rib fractures often happen with this kind of trauma. Broken ribs make breathing really painful, shallow, what we call hypoventilation.
Not breathing deeply enough.
Right. And in really bad cases, you can get something called flail chest. That's where a whole section of the rib cage breaks free and actually moves in when the animal tries to breathe in, makes breathing incredibly difficult.
Wow, that sounds severe.
It is. And then there's the heart. The force of the impact can bruise or injure the heart muscle itself, leading to abnormal heart rhythms or arrhythmias.
What kind of arrhythmias?
The sources point to ventricular tachyarrhythmias, basically really fast, potentially dangerous heartbeats as being the most common type seen after this kind of trauma.
When do those usually show up?
Typically 24 to 72 hours after the injury. The good news is they often resolve on their own within about 5 days, but they definitely need monitoring.
Okay. And overarching all this is the risk of shock, I imagine.
Always. With severe trauma, there's always the danger of the whole system going into shock, potentially leading to multi-organ failure if it's not treated quickly.
So it really can be a widespread systemic issue, especially from trauma. Now, think about who gets this. Are certain animals more prone?
Yeah.
Specific breeds, ages.
Well, our sources say both dogs and cats can get diaphragmatic hernias, both the acquired and congenital kinds.
Okay.
For the acquired ones, the trauma-induced type, there don't seem to be any specific breeds that are more likely to get it than others. It's more about exposure to trauma.
Right. But what about the congenital type, the PPDH? Any predispositions there?
There might be. There's a suggestion that Weimaraners might have a higher risk among dogs. And in cats, Maine Coons and other long-haired breeds seem to be overrepresented in the cases reported.
Interesting. So maybe a genetic link in some of those congenital cases?
It does suggest a potential inherited component, yeah.
And what about age? Does that play a role?
Age is definitely a factor. Younger animals seem to be at higher risk for both types congenital, obviously, but also traumatic ones, perhaps due to behavior or bone structure.
Okay.
And an important point about congenital hernias, even though they're present from birth, they might not actually be diagnosed until the animal is much older, because the signs can be really subtle, or they might come and go. So sometimes these are just found incidentally, during a vet check for something completely unrelated.
So it's not always obvious straight away. What kinds of signs should an owner look out for then? What might clue them in?
With the traumatic kind, the signs can hit very suddenly, right after the accident, but sometimes they develop more slowly. Maybe the owner doesn't even recall a specific injury.
So it could be gradual?
Yeah, you might see just sort of low-grade breathing issues or maybe some vague digestive upset that seems to slowly get worse over time.
Okay. But what are the most common obvious signs?
The biggest flags are usually rapid breathing, that's tachypnea, and clear difficulty breathing, what we call respiratory distress. If it's acute, right after trauma, the animal is often in shock too.
And besides the breathing, what else might be noticeable? Maybe during a vet exam.
Well, you might actually see changes in their heart rhythm on an ECG. A vet listening with a stethoscope might hear muffled heart and lung sounds. And, maybe surprisingly, they could even hear gut sounds like gurgling up in the chest.
Intestines in the chest, wow.
Yeah, and when they feel the belly, it might seem strangely empty because some organs have moved up.
Okay. Is there anything really critical, like life-threatening to watch for?
Absolutely. A major emergency is when an organ, like a loop of bowel or even the stomach, gets trapped and twisted in the chest opening. This is called incarceration or strangulation.
I found that.
It's extremely serious. Signs include things like vomiting, diarrhea, retching without bringing anything up, a bloated abdomen, obvious pain, and potentially sudden collapse. It needs immediate attention.
Definitely an emergency. What about the signs for congenital hernia? Are they different?
Like we said, they might have no signs at all initially, or signs might develop later. When they do appear, they can involve breathing, the heart, or the digestive system.
So similar systems affect.
Right. Things like difficulty breathing, maybe muffled heart sounds again, sometimes a heart murmur is heard. And you might notice those other congenital issues we listed, like the belly wall defects.
And can they also have those sudden emergencies like organs getting trapped?
Yes, absolutely. Sudden, severe signs can happen if trapped bowel or maybe liver or spleen gets its blood supply cut off. Or sometimes fluid can build up rapidly around the lungs, that's pleural effusion, or around the heart, pericardial effusion, causing sudden distress.
Okay, so quite a spectrum of signs, from subtle to critical.
Yeah.
This really highlights why getting a proper diagnosis is so important. What actually increases the risk of getting one, especially the traumatic kind?
Well, for traumatic hernias, the biggest risk factor is pretty straightforward. Lack of confinement and exposure to cars.
Roaming unsupervised.
Exactly.
Right.
Any significant blunt force trauma is a risk. Statistically, animals allowed to roam and male dogs seem to be more affected, likely just reflecting a higher chance of getting into accidents.
Makes sense. More opportunity, unfortunately, means more risk. So how do vets actually figure out if it is a diaphragmatic hernia, especially with that wide range of signs?
Diagnosis involves a few steps. First, they need to rule out other things that cause similar signs. Difficulty breathing, fast breathing, fluid in the chest, that sort of thing. There's a whole list of possibilities, what vets call differential diagnoses.
Okay, rule out the other stuff. Then what?
Initial lab tests, like blood work and maybe a urine analysis, can be helpful. They might show nonspecific changes, maybe related to shock or poor blood flow, but they don't point directly to the hernia itself.
So lab tests give clues, but aren't definitive.
Right. The real key, the cornerstone of diagnosis, is imaging.
Imaging, so x-rays.
Exactly. Standard chest and abdominal x-rays, usually taking at least 2 views, like one from the side, one from the top or bottom, are crucial.
Anything special about the x-rays?
Sometimes a specific technique called horizontal beam radiography can be really useful. That's where the animal lies on its side, but the X-ray beam comes across horizontally. It can help show fluid levels or misplaced organs more clearly.
Okay. What else besides x-rays?
Ultrasound is often very helpful too. It uses sound waves to create images and can directly visualize organs moving through the diaphragm or fluid in the chest. Sometimes contrast studies are needed.
Contrast, like injecting dye.
Sort of. You might give a special liquid barium meal to outline the stomach and intestines on X-ray and upper GI series. Or sometimes inject a contrast agent into the abdomen, that's peritoniography, to see if it leaks into the chest.
I guess in really tricky cases.
For complex situations or if things still aren't clear, a CT scan can provide much more detailed cross-sectional images. And if there is fluid in the chest, performing a thoracocentesis using a needle to draw off some fluid can sometimes help with diagnosis, and it can also make the animal more comfortable.
Okay, so it sounds like often a combination of exam findings and definitely imaging is needed to nail the diagnosis. Once it's confirmed, what's the plan? What are the treatment options?
For traumatic diaphragmatic hernias, the immediate focus is usually stabilizing the patient. This means inpatient care in the hospital.
Right, not straight to surgery necessarily.
Not always, no. The priority is treating shock, supporting their breathing and heart function, managing any other injuries they have, basically getting them strong enough to potentially handle surgery.
So stabilize first, but when is surgery an emergency in these trauma cases?
Surgery becomes urgent, like really necessary right away if the animal has persistently low blood pressure despite getting fluids, or if they're in severe respiratory failure because the lungs are just too compressed.
Okay.
Also, if there's evidence of severe liver problems because the liver is trapped and damaged, or if the bowel has ruptured, or if repeat x-rays show a gas-filled loop of bowel in the chest that's getting bigger and bigger, that needs fixing fast.
But you need them stable enough.
Exactly. There's a caution here. Surgery isn't likely to help and might even be harmful if the patient is just too unstable overall. And there's one very specific emergency.
Yeah.
If the stomach herniates into the chest and rapidly fills with gas, it's called intrathoracic gastric dilatation that needs immediate decompression, like passing a stomach tube or using a needle, even before thinking about definitive surgical repair. It's life-threatening pressure.
Wow, okay, that sounds incredibly urgent. What about treating the congenital kind, the BPDH?
For congenital hernias, surgical repair is the standard treatment, and the recommendation is generally to do it as early as possible.
Why early?
To minimize the chances of scar tissue forming between the herniated organs and the chest structures, which can make surgery harder later, and also reduces the risk of those organs getting trapped or strangulated. But just like with trauma, stabilizing the patient before surgery is still really important if they're showing signs.
Makes sense. Are there specific medications used commonly? You mentioned heart rhythm issues earlier.
Yes, definitely. If arrhythmias are present, antiarrhythmic drugs might be necessary to help control the heart rate and rhythm.
Okay. Anything else medication-wise?
A really important consideration is fluid therapy, especially for shock. You have to be cautious if the patient has significant lung bruising pulmonary contusions.
Why is that?
because giving too much intravenous fluid can actually make lung problems worse, leading to fluid overload and more edema. It's a delicate balance. The sources mention that certain types of fluids, like synthetic colloids, maybe hetastarch, might be beneficial in these cases because they help maintain blood pressure potentially, with less risk of leaking into the lungs compared to standard crystalloid fluids.
So very careful, tailored fluid choices are key, especially with lung injury. Got it. After treatment, surgery maybe, what's the recovery period like? What should owners expect?
Follow-up requires really close monitoring, especially monitoring the heart. Frequent or even continuous ECG monitoring is often recommended, particularly watching for those post-operative arrhythmias we talked about.
Okay, keep a close eye on the heart. What other potential issues can come up after surgery?
Well, one possibility is pneumothorax, that's air accumulating in the chest cavity outside the lungs. It can happen during anesthesia or sometimes after surgery. If not all the air is removed properly, it might require intervention.
Hair of the chest, okay.
And interestingly, post-operative high fever is apparently quite common in cats after this surgery. Also, pulmonary edema fluid in the lungs can develop after the organs are put back.
Why would that happen after fixing it?
Several reasons, potentially. Blood loss during surgery, inflammation from the original lung bruising, or sometimes something called re-expansion pulmonary edema. That can happen when a lung that's been collapsed for a while is suddenly allowed to reinflate quickly.
Oh, okay. So the period right after surgery sounds like it needs very intensive care.
Yeah.
What's the overall outlook then? The prognosis?
Initially the prognosis is always considered guarded, meaning we're hopeful but aware things could go wrong.
Cautiously optimistic.
Pretty much. Factors that point towards a better outcome include successfully managing the initial shock, getting any heart rhythm problems under control, having a successful surgery, of course, and not developing that re-expansion pulmonary edema complication.
So avoiding complications is key.
Definitely. And there's one specific note of caution in the sources. Older cats that suffer a traumatic diaphragmatic hernia seem to have a lower chance of surviving the surgery compared to younger cats or dogs.
Good to know. So it sounds like getting diagnosed early, getting that initial stabilization right, and careful post-op management are all critical for a good outcome.
Precisely. It's often a multi-stage process requiring intensive care.
Okay, great. Let's try and wrap up the key takeaways here. Diaphragmatic hernia. Basically abdominal organs moving up into the chest through a hole in the diaphragm muscle.
Right. And it can happen either because of an injury that's acquired, or it can be something the animal is born with congenital PPDH.
The signs can really vary, but breathing problems are common, sometimes digestive signs too, and diagnosis heavily relies on imaging, like x-rays and ultrasound.
And treatment usually involves stabilizing the patient first, and then often surgery to repair the hole and put the organs back where they belong.
So what's for our listeners? Understanding this can help you be more aware, especially if your pet has had some kind of trauma, even if it's seen minor, or if they develop strange breathing or tummy issues.
Absolutely. Early detection and getting proper veterinary care quickly are really crucial for giving them the best chance.
Definitely. And, thinking about how trauma can cause this cascade of issues, the hernia, the lung bruising, the heart problems, it really makes you consider what other, maybe seemingly unrelated symptoms could actually be linked back to an underlying injury you didn't even suspect at first.
That's a great point. It's a good reminder of just how interconnected everything in the body is and how one insult can have effects that ripple outwards in ways that aren't immediately obvious. Food for thought.